if you're using SEL mental health, you got three scores. You got an SEL score, which can be broken down into 5 domains, but you got one total SEL score, you got a total internalizing emotional behavior concern score, and you have a total externalizing emotional behavior concern score. You want scores to be high for the SEL, you want scores to be low for both the internalizing and externalizing. So you got 3 basic scores you're thinking about. You can think about that at the school level, at a grade level, or an individual student. Now with what we call SARA, stress and resilience assessment, you have 5 scores to deal with. You have those same 3 I just named, and you have 2 additional stress indicators, and you're going to be able to get that if you want to from a teacher, a parent, a student, or just one. And then from the student only, you got a stress management score. And so those are going to form this 5 points of understanding about a student or a group of students, and they are very actionable. They actually have aligned lessons to the class-wide intervention program, CIP-T2 program, and there's others out there. Not as good alignment with that, but nevertheless pretty good. To date, we're the only assessment out there that actively, directly measures stress and shows its relationship to mental health issues, and it has a research foundation to it that says if children are having mental health difficulties, part of the action you must take is to help them understand stress and to come up with strategies to reduce stress. It is a simple little addition that I think it can make a big difference in terms of early in children's lives to understand this. So the Resilience Behavior Index is going to be based upon the SEL or social skills. There are 20 key social skills, and then the stress management strategies. Those 2 together are the basis for the Resilience Behavior Index. Then there's a stress index. The stress index is the measure of the stress indicators, and it is not a pure additive measure, but it's that you have high, moderate, or low stress with co-occurring mental health issues or not. And so it's actionable, it drives you. And so it tells me if I have high stress and no mental health issue, okay, then I just have to intervene on the stress. If I have high stress index and a co-occurring mental health issue, that says there's 2 places I have to intervene. There's, an action plan that follows from this. We start with data and say, why would you use this program, and what sort of profile do children have that need these things? Well, you want stress index to be low and you want RBI to be high. There's added pieces of information to act upon, but I think it is desirable to do it in an integrative way. And that's what we've done. Instead of using a measure to measure SEL, a measure to measure bullying and mental health, a measure to measure stress, we brought it together. And as important as anything, there's a time efficiency from capturing this information, as well as a validity issue. At one point in time, we're understanding how you're functioning in all these areas, as opposed to this week, we looked at SEL, and in a couple of weeks, we're going to measure mental health and stress with some other measure. That's pretty messy, and it's likely to lead to some, I think, poor data and poor decision making as a result of that.